Hello everybody. Today in this video I will talk to you about how to approach the UR questions, how to answer, how to just omit the options, and what else to do when you are just reviewing your questions, and how to annotate all, and what are the important things that you all need to annotate from the UR into your first aid or notebooks. So we'll just leave it to the full screen. So whenever you see a UR question, or whenever you see encounter USMLE style question, the first thing that you need to do is that you read the last line first. Okay. So which of the following is the most likely cause of this patient's condition? Now, by reading this one line, you now know that this question is asking us about the cause. And when you just highlight this last line, and then you have that subconscious thinking that I need to find the cause, and then it becomes very, very easier for you to just go through the question and pick up what is really important in the long question stem. Because whenever you read a question of the USMLE, actually the questions in the real exam is way more longer than the UWorld style questions. Most of the questions are just like that. The questions are way more longer than the NVMe style questions. So whenever you go on reading the question, you will go through a range of emotions. So if you do not read the last line first, then you will just go through a range of emotions, and then you get lost by the time you finish the question. So then you do not know what to pick up in the question stem. But when you read the last line first, then you know that what to pick up in the question stem that will help me to answer the question that is being asked here. Now, the question is asking us about the cause of this patient's condition. So what are the important things that we need to find out the cause? Remember, you do not have enough time to reread the questions. You have only one shot, only enough time to read the question one time in the real exam. So here we have a 2-month-old boy, okay, so age and gender is important, is brought to the emergency department due to progressively worsening floppiness and poor feeding. The infant was born in Eastern Europe via an uncomplicated vaginal delivery to a 38-year-old woman, and then immigrated to the US with his family. So I do not think that this line provides us with any of the important information that is required to answer this question. So, but however, we need to understand that the patient was an uncomplicated delivery, a 38-year-old woman. So the person was a term. Okay, there is nothing to worry about the preterm gestation or the preterm births. So the parents described the infant as a good baby who rarely cries and sleeps through the night, but has lately been difficult to rouse for breastfeeding. Okay, so the history is that the baby is a good baby. The baby does not have any developmental disorder or any developmental milestone disorders. The baby rarely cries and sleeps. Okay, so the baby is not irritable, and the baby is normal sleeping, but has lately been difficult to rouse for breastfeeding. So the baby is becoming floppy. Okay, the baby is becoming depressed. So the stools have also decreased every other day and are small and parrot-like. So this describes us that the change in these stools. So the stools have decreased and they are small and parrot-like. So these are like the mouse stools, we say this, okay? And these are the typical features of constipation. Now, on physical examination, that is important, shows a hypotonic infant with a large anterior fontanelle, large tongue, and a reducible umbilical hernia. Now, this line provides us with the information that the tone of the infant is decreased and the patient is having large anterior fontanelle. The tongue is also increased in size, and the patient has a reducible umbilical hernia. Now, this is one of the most important line in this entire question, which will help us to reach to the diagnosis. Now, it also mentions that he has low tone and is unable to hold his head erect on its own. So the tone is decreased, right? So no other abnormalities are seen. Now, which of the following is the most likely cause of this condition? Now, here you can see that when we combine all of these features, not just looking at this highlighted question, when we go through the options, then we know that, like, first we just encounter botulism, right? So in botulism, is there floppiness, right? Is there hypotonia, okay? But is there decreased or small parrot like stool in botulism? Probably not. Okay, and is there large anterior fontanelle and large tongue and reducible hernia in this patient in case of botulism? Probably not. And whether the patient has a history of honey feeding, okay? No, the patient does not have that. So botulism is gone, according to me. Now, just like that, when you go on just removing all the options, the omitting all the options, then you find out that the most plausible option here is the congenital hypothyroidism, right? Because here the patient was a good baby initially because the maternal thyroid hormones were acting, but initially, but the lately due to the maternal thyroid hormone suppressing the hormonal release in the child due to the negative feedback, then the patient started showing symptoms of constipation, small parrot like stools. The patient became hypotonic, and the patient have typical features of congenital hypothyroidism like the large anterior fontanelle, large tongue, and a reducible umbilical hernia. Now, now what happens in hypothyroidism is that initially the maternal hormones that are there present in the child will help in the normal functioning. But later, when this hormone wanes off, then there is the decreased thyroid level in the child because of the negative feedback due to the preformed hormones by the mother that was present in the child. So due to that, the child goes into congenital transient hypothyroidism, and then the child will produce with these symptoms. So we just and then again, when we just go through the symptoms of Down syndrome here, then we cannot see any other symptoms that are typically associated with Down syndrome. Okay, the only thing is that the baby is born to the elderly primary gravida, but there are no other symptoms that are typically matching with Down syndrome. So Down syndrome is gone. So galactosemia is generally there when the baby is having gastric symptoms mainly, or the baby is having any eye symptoms like after the feeding of the milk or something like that. Okay, but also in case of Hirschsprung disease and all, the baby will be having gastrointestinal symptoms, but the baby will not have hypotonia or large anterior fontanelle. Now we just check up the hypothyroidism, and then we just move forward. Okay, now that was the right answer. Now whenever you just review the questions here now, the UWorld tables like this are the most important part of the UWorld question bank. So what you do is that you can just cut out this table from here. So if you're using iPad or something, you can cut out from there. If you are someone who is using laptop like me, then you can just search for the snipping tool, right? Now, then you just get this snipping tool, and then you just cut out this table from here like this, right? Now, when you have this table with you like this, then you can just annotate this table in your digital copy of the first aid, or you can just annotate it in your UWorld notebook, the dedicated UWorld notebook that you are preparing. Or also, if you are someone who uses Notion, okay, the Notion app, then you can copy it there, or anywhere you just like this to be present to the further review, because you cannot review the whole question bank the next time, but these uh, tables will actually provide you with everything that you need to know about the topic, right? So this is the one thing that you can do. Now just review the question bank with me now. So while reviewing the topic here, so when you just read the tables, then it will become so easy for you to understand this all, right? So congenital hypothyroidism, clinical manifestations, so usually asymptomatic at birth, and then after maternal thyroxine wanes, that is from weeks to months, then the baby will be having lethargy, poor feeding, enlarged fontanelle, protruding tongue, right? And the baby will have constipation, dry skin. And what is the diagnosis of thyroidism? Okay, so any sort of hypothyroidism. So what is now, what is the diagnosis of hypothyroidism, congenital hypothyroidism, right? So, if there are decreased free thyroxine levels, then because the maternal thyroxine have already waned off, if there are decreased free thyroxine levels, then there will be decreased negative feedback, and then the TSH will increase. Okay. Now, this is all the theoretical part that you like the treatment and the prognosis are. So, what you can do is that you can just snip out this. Table, okay, using the snipping tool that I already showed you, I think. So again, so you can just snip it like this, and you can just copy it anywhere you want, right? Then also then you just move towards this uh, highlighted part. Okay, so because there was a little bit of internet connection issue in between there, it is already highlighted. But yeah, you can just again highlight the text, the theoretical text that is there. Okay, most important cause of preventable intellectual disability. Okay, you can just highlight this, and after that, like you can just see the pictures here if you want. Okay, or there are any videos, you can download the videos if you want, like this, right? So after highlighting all this text, then again you can use the snipping tool new, and then if you want, you can just uh, copy this like that, because you cannot copy the text from uh, URL, right? You cannot copy the text from URL. They have already made it so much secure, so you cannot copy the text. But yeah, you can do this. You can highlight everything that is important here, and then you just move towards why the other options were wrong. Now, if you are someone who is there in like your initial phase of preparation, and you have enough time while preparing, and then you can just go through all the wrong options. Okay, you must go through all the wrong options. No, the wrong options will not only increase your knowledge about the topics, but it will also increase your understanding about why I made this question wrong. Okay, did was there any information that I missed? Did I ran through the question too fast? Okay, or knew did I know nothing about the concept that is asked in the question? Is the concept is totally new for me, or I never saw this concept ever? Because in while solving UWorld, there will be many more topics, many more concepts that will not be there in your videos, that will not be there in your fossil. So there is no point in banging your head because you did not know the concept, you did not know the topic. It is because that was not present anywhere you read the topic. So you just make a list of the question. Okay, question IDs like question ID 1407. Okay, this question I made wrong because I missed a concept, or because I missed an important information that was needed, or I missed this question because this concept was totally new for me. Okay, you just categorize all these questions in an Excel sheet or somewhere like that. Okay, and this will help you track your knowledge, or this will help you because there will be many, like if you just solve 40 questions, there may be 10 questions that will be completely new concepts for you. And when you look at the percentage correct in the UR question bank, then you can just get depressed. But when you track the questions like this, doing making a Excel sheet where you just like enter the question ID, and you just enter the cause where why did you made that question wrong, then that will be your true track of the question bank, or that will be your true track of the progress. Okay, now you just go through all these wrong answers. Okay, why these wrong answers were wrong, and it will also provide you that with the information about what should be or should not be present in the patient to have the diagnosis or to have these all conditions, right? And then you can also just go through these pictures and all. Okay, or if you want, you can again just have this copied, and again you can paste it somewhere anywhere you like, right? So, and at last, there comes this educational objective. Now, this is the most important piece of information in this entire question set. Okay. Now, what you can do is that either you can copy this table only, or you can copy this only. But one thing that will be compulsory every time is this educational objective. So again, you will just open your snipping tool. Okay, you can go for new, and then you just cut it like this. Okay, and then you make a PDF. If you are someone who is in the initial phase and you are doing random or system wise your question bank, okay, then I just want you to make the PDF of all these educational objective. Okay, no need to mention the question ID or something like that. Okay, you just make a PDF here, or you can find a PDF floating here and there on the internet. Like if you know how to surf the internet, you can get everything there. There are some PDFs there and they're circulating there in on the internet, and you can just copy and make a PDF of all these educational objectives, right? Now, what will happen is that after your question bank is all over and all gone, and then you have this PDF of educational objectives. Now, then you can just revise this educational objectives, and by the time you complete that PDF, you have already revised the whole of the question bank in snap of time, right? Trust me, in the real exam, there is a very less chance that you will actually remember the theory or the video or something like that. Yeah, you will remember, but the most thing that you will remember is your question bank. Okay, you will be like, okay, there was this concept. I have seen somewhere this concept in some question, because what you are doing is that you are doing an active learning set of questions. That's what the roadmap to residency is all concerned about. Our USMLE courses are also designed that way. So you are just doing active questioning, you are just doing active learning like that, right? So now you can just make the PDF of educational objective. You just revise all the educational objectives before your exams, and then you have just revised all the question bank. Yeah, okay, and then you will just in the exam remember what you have actually solved in the question bank, or how the question bank mm, presented this patient or this condition, right? Because in a real question bank, instead of just directly going in this, like, okay, this is the option in this, so that's most of the time you will be like, okay, so this is not the answer, this is not the answer, this is not the answer, so maybe these two are the answers. So I will go with this one. So if you can just narrow down all the seven options to two, that will be like 50-50 chances for your questions to be right. I had one question in my exam that had total 11 options, right? So how can you just be sure that this is the answer? You have to be have a very, very sharp knowledge, or you need to follow this rule that I have all talked with you. So if you just follow everything that I tell, and if you ask that, what is the one piece of advice that I gave you through this video? What is the one thing that you should must do? Okay, then I will suggest you, number one is that you just copy these educational objectives. And if you have a little bit of more time, you just copy all the tables and all the flowcharts that you find in the Uworld. And then you make a PDF of all of that. Now, thank you for watching. We will again back in the next one with again next super duper concept. So thank you for watching all.